Lupus, the invisible enemy that could be silently attacking your body. Did you know there's a silent disease that can strike anyone, anytime, and tear your body apart from the inside out without you even realizing it? This is lupus, an autoimmune condition that baffles doctors and patients alike, changing lives overnight. What is lupus? Lupus is a strange and challenging disease. Unlike a common cold or infection, lupus is a disorder where your own immune system, which is supposed to protect you, starts attacking your organs, tissues, and cells. Imagine that. Your body mistakenly fights itself, creating an invisible battle that can be incredibly destructive. Lupus can hit anyone but is especially common among young women, becoming a constant worry for so many individuals and families. Here are the main types of lupus explained in simple terms. 1. Systemic lupus erythematosus, SLE. Systemic lupus erythematosus, or SLE, is the most common and often the most severe type of lupus. It can affect multiple parts of the body, including the skin, joints, kidneys, heart, lungs, brain, and even the blood system. SLE is known for causing a wide range of symptoms that come and go in cycles, making it unpredictable and hard to manage. Common symptoms include extreme fatigue, joint pain, red rashes, such as the signature butterfly rash across the face, and kidney issues. Every person with SLE can have a unique mix of symptoms, and flare-ups can vary greatly in intensity. 2. Discoid lupus, cutaneous lupus. Discoid lupus mainly affects the skin, causing red, scaly lesions that can sometimes leave permanent scars. These lesions usually appear on areas exposed to the sun, such as the face, scalp, ears, and neck. While discoid lupus is limited to the skin, it can be challenging for those dealing with its symptoms and visible scars. In some cases, people with discoid lupus may eventually develop SLE, but this is relatively rare. 3. Drug-induced lupus. This type of lupus is triggered by certain medications and, fortunately, is temporary. Drugs that may cause drug-induced lupus include some blood pressure medications, anti-seizure drugs, and antibiotics. The symptoms are very similar to those of SLE, such as joint pain, fever, and inflammation, but they usually go away once the patient stops taking the medication causing the reaction. 4. Neonatal lupus. Neonatal lupus is a rare type that affects newborns and occurs when the mother has certain autoimmune antibodies that can pass to the baby. This type of lupus can cause skin, liver, and heart problems in the newborn. Most symptoms fade over time without lasting damage, though, in rare cases, babies may develop permanent heart issues. It's important for women with lupus or other autoimmune diseases to have close monitoring during pregnancy to reduce risks. These are the main types of lupus, and each affects people differently. Even mild cases require medical attention and monitoring so that patients can maintain a good quality of life and reduce the disease's impact on their daily routines. What causes lupus? This is a question that haunts many, especially those living with lupus or who know someone who does. The truth is, we still don't have all the answers. Lupus isn't caused by just one thing. It's a mix of genetics, hormones, and environmental factors that somehow come together in a perfect storm to trigger lupus in certain people. Something as simple as too much sun exposure, a viral infection, or even stress can set it off. Science is advancing, but lupus continues to be full of mysteries. What are the symptoms of lupus? Lupus is known as the great imitator because its symptoms can look like those of many other diseases. It can show up in many ways. Extreme fatigue that doesn't go away with rest, joint pain, red patches on the skin, especially across the nose and cheeks in a butterfly shape, ongoing fevers without any obvious reason, hair loss, sensitivity to sunlight, and even issues with the kidneys and lungs. These symptoms come and go, creating a painful and unpredictable cycle that often leaves patients unsure of what each day will bring. Imagine waking up every day not knowing what your own body will put you through. That's life with lupus. What types of tests diagnose lupus? Diagnosing lupus isn't easy because there's no single test that can confirm it. Doctors usually run a series of tests, including blood and urine tests, and carefully examine the symptoms. One common test is the ANA, antinuclear antibody test, which helps detect the presence of autoantibodies in the blood. But even with tests, it can take a while to officially diagnose lupus. For someone already worn down by symptoms, this journey to diagnosis can be exhausting. It's like piecing together a complex puzzle, where every test is a crucial piece. What are the treatments for lupus? There's no cure for lupus, but treatment is essential to manage symptoms and minimize the damage it can do to the body. The approach to treatment often involves a team of specialists working together to address different aspects of lupus. Physical therapy, counseling, a balanced diet, and strategies to handle stress are all key parts of treatment. It's not just about treating the body, but also helping the patient regain the quality of life that lupus so often takes away. What medications help with lupus? There are medications that can help control lupus by preventing the immune system from attacking the body too aggressively. Common options include nonsteroidal anti-inflammatory drugs, NSAIDs, for pain and inflammation, antimalarials like hydroxychloroquine for skin and joint symptoms, corticosteroids to quickly reduce inflammation, and immunosuppressants that lower immune activity. Each medication has its benefits and side effects, and treatment is highly personalized based on each patient's needs and condition. It's a careful balance, where both doctor and patient have to work closely together to find the best approach amidst all the challenges. Living with lupus is a daily struggle. Everyone dealing with this disease faces unique battles and needs as much support as possible to get through the hard times. Here on our channel, we're committed to bringing you knowledge, compassion, and understanding for those in this fight or those with loved ones facing it. If you know someone who needs to hear this or want to keep learning more about health, please like and subscribe. Together, we can spread awareness and support so no one has to face this journey alone.